Hi class, this is Andrea Mahoney. I am here to share with you a presentation on gastroschisis and help you understand this rare birth defect for our first presentation in embryology. So what is gastroschisis? It is an opening or a hole that's in the abdominal wall. It occurs very early in gestation, around the 6th week of development. And what happens is the baby's bowel and even other organs such as kidneys, stomach, liver, bladder, they will move outside of the body for the remainder of the pregnancy. And so since there's no covering over the bowel, it's completely bathed in amniotic fluid until the infant is born. So there's been a lot of research that has tried to compare vaginal delivery versus a cesarean delivery for these kiddos, but there's been no supporting evidence that says that a C-section is the only way to go. So frequently in my institution, we actually do see these babies born vaginally. And that is the recommended route of delivery unless there's a specific indication for a C-section. So here I just wanted to give you an opportunity to visualize the gastroschisis. So if you look where the umbilical cord is, you can see where the abdominal wall defects takes place. In most cases, it is to the right, just like it visualizes here. And you can see where the intestines are herniated outside of that abdominal cavity. And so that defect to the right side of the umbilical cord, all of them bowels, it can also be, in addition to the intestines, it can be bladder, stomach, liver, other organs that should be within the abdominal cavity. And so they will put all of that back in. But you can imagine that with that hole being as small as that is, it takes some time if it's a large defect to get that all back into the abdominal cavity. So when we examine the causes, risk factors, and treatments for gastroschisis, it's a little ironic that they are unable to isolate a single cause. And so they theorize that there are changes in the genes or chromosomes of the developing fetus, or that the mother came into something in contact with something in the environment, whether it's something she eats, something she drinks, certain medicines that she may have used during the pregnancy that may have been introduced during that critical 6th week of development when those bowels are being formed. So the CDC conducts a lot of research, and one of the things that they have found a correlation to is age. So teenage mothers are more likely to have a baby with gastroschisis than an older mother. Additionally, women who consume alcohol or who are smokers are more likely to have a baby with gastroschisis as well. It is important to take note that this disease affects males and females in equal numbers. So the estimate of birth prevalence for this disorder is approximately 1 in 1,500 to 1 in 13,000. And during pregnancies, there's lots of screening tests that can be done prenatally to check for these birth defects and other conditions. So they might get an abnormal result on a blood or serum screening test, or they might see something abnormal on the ultrasound. It'll usually be pictures of the baby's bowel outside of the body right in the womb. And they're able to diagnose that and then start making birthing plans in preparation for the delivery at that point. So it'll obviously be seen immediately at birth. And if the defect is small, so just some intestine outside of the body, they'll usually take the baby the same day for surgical treatment to put the organs back and close the opening. So this is frequently what I see in my institution. If it is small, they take the baby right away. If the defect is large, if they have several organs outside of the body or a very large amount of bowel, they'll do the repair slowly in stages over several months, and usually with a silo, and then the exposed organs are covered with a special material and slowly put back into the belly over time. It has to be a slow process when it's a large defect. So it's important that we are cognizant that they need other treatments as well. So IV nutrients, antibiotics are a must to prevent infection. And then we have to pay such careful attention to control the baby's body temperature. So it is important to also take note that although 90% of infants now survive in developed nations, there is still a 10% mortality rate due to complications post-op. So, when we look at awareness for this disorder and the statistics in the state of Michigan where I work, one thing that I found that was really cool is that there's a Gastroschisis Awareness Day. And this year it took place on July 30th, but it is recognized every year throughout the month of July and August. So, the CDC estimates that there's about 1,800 babies born every year in the United States with this disorder, but that since the 1980s, the number of babies born with it has just increased again, especially among those young mothers. So um, it is not known to be associated with any other organ anomalies or with chromosomal problems, but in about 10 to 15% of the babies with it, some of the bowel may be abnormal. And usually it's caused from an atresia. So where the bowel starts forming, it stops, and then a blockage results from that, and then the bowel starts forming again. So these kiddos have to have a planned delivery in a high-risk birthing center where they can be transferred into a newborn intensive care unit after the pediatric surgical services are provided. So when we look at the prevalence of gastroschisis by race and ethnicity, we see that Black mothers have the highest reported cases related to gastroschisis, with whites and Hispanics following right behind them here in the state of Michigan. And then Asian mothers have the lowest prevalence of the disorder, as you can see. And then when we look at by a maternal age, that's really kind of staggering to look at. So the prevalence is highest among mothers less than 35, with it rarely being seen in mothers than older 35 in the state of Michigan. So just quickly taking a side-by-side comparison of the home state I live in of Ohio and the state I work, Michigan, I wanted to look at the culmination of all birth defects seen. This isn't isolated gastroschisis alone, so I'm not going to stay here long, but both states share an average of 1 out of every 33 births having a birth anomaly. So in Ohio, they see 138,000 babies born annually. 4,100 of those will present with a birth defect, and 1 out of every 5 of those babies succumb fatally directly related to the birth defect. In Michigan, there's 113,000 babies born annually, with 3,400 of them born with a birth defect. Then, again, similarly, like Ohio, it is expected that 1 out of every 5 of those children will die. So, again, another reason just to highlight bringing advocacy and funding and research all to in the name of birth defects. So while looking into the research and trying to find out what foundations and websites are out there that provide the most useful amount of information related to gastroschisis, I obviously found hundreds and hundreds of websites, but the official foundation is averysangels.org, and they are recommended by the CDC, and they are a website that is for parents and families. That is who they're marketed towards, but healthcare professionals can go on there and get very useful information as well. So it's a foundation that's dedicated to research and awareness and support for patients and families. They are strictly all volunteer, they're nonprofit, and they provide all kinds of resources. They include statistics, treatments, all the latest research, and they've developed a national and international networking system for families. So there's options for emotional and financial support. They have external links, articles, printable information, and they sponsor the National Gastroschisis Awareness Day that I just told you about on the previous slide, that provides education and offers updated news and events information. Next, I found the National Organization for Rare Disorders, which is again a website for parents and families. This organization has been in for around 35 years. So they're affiliated with supporting foundations. They have articles, textbooks, online discussions, and blogs. They discuss in depth the causes, populations affected, the related disorders and therapies, and all the newest research. So they have educational information, they provide it into sections. So it's organized for patients, organizations, or if you're a clinician or a researcher going in there. And they advocate for the education and individual involvement to reduce rare disorders that children are born with. So patient advocacy is a number one with them. The National Association of Rare Diseases is affiliated with actually over 280 patient organization foundations. So they're very committed to identifying, treating, and curing rare disorders through education, advocacy, research, and patient services. Finally, the third most prevalent one I found was the National Institute for Health, which is mostly aimed at healthcare professionals. However, there's useful information for everybody. It provides health information, grants and funding, news and events, research and training that's being offered. They offer support, education, and sources of financial support to families. And they also provide a way to locate specialists to the families. So, as practitioners, it's going to be really important for us to address the issues in both the NICU with these families while their baby is with us and under our care, and then also develop a plan for discharge when these kiddos are going to go home, because it is so important that we be cognizant to the fact that the whole family is impacted by a birth defect. So they face really unique challenges, and their biggest desire is really just to make their family life better. They want to make a better life for their child. Um, and a lot of them just want to help prevent birth defects in the future. They become some of the biggest advocates for research and funding. So, some of the challenges that parents face that we can be involved with are emotional, financial, and logistic implications. They struggle with bonding, they have anxiety and fear, and they feel ill equipped to take care of this child that has this birth defect. Sometimes they feel that communication with healthcare professionals is lacking, and we can obviously support that and make sure that there are clear communication without barriers. Some of them need grief counseling because although it sounds a little odd, they do go through stages of grief similar to somebody who has lost a child. They are concerned with quality of life issues and what the long-term implications of this disease is going to mean for their child. A lot of these parents want to create awareness and advocate for research and funding, and they want to find resources and support to support themselves and their family members and their child once they go home. When the child grows up, a lot of them have a great, healthy life, and there's really no indication that they have ever had gastroschisis other than the scars. But it's important that we help them transition as appropriate and also to receive specialized adult care if they need it. So this can be a lifelong thing that we really need to be cognizant of, and it starts in the NICU while we're caring for them, but we create that plan for the post-discharge while they're with us. So I won't go into a lot of depth on this, but this was a graph that I pulled from a LEMAX journal article that I read, and it just kind of highlights all of the things that I said from the previous slide. These are the things that the parents of children with gastroschisis and other birth defects discuss. So communicating, coping and adapting, the quality of care, the quality of life, and transitioning are their four main concerns. And this, if you just kind of go through this chart, really hits home what they need and how we can provide resources for them. So when I look at the local resources here in Michigan for gastroschisis, the University of Michigan is one of only a few centers in the entire nation where we have a birth center, and it's co-located with a comprehensive children's hospital. So the unique setting allows for integration between a private room birth center into our state-of-the-art newborn intensive care center. And we have access, the parents have access to around-the-clock pediatric surgical services, and it's all on site. So even though gastroschisis is considered random, there is a chance that it could happen in another pregnancy, but it's only 4%. So we bring doctors and genetic counselors in that review all the risks and discuss all the options and resources with the family. So we have specialized teams that are available through each listed intervention that provide a developed care plan that's individualized with treatment options. So because this hospital is nationally known and regionally sought after, there are many families that return to their homes in different parts of the country from the hospital I work at. So our team here at U of M creates direct links between our facility and the family's individual local resources so that they have the best possible outcomes for care for their newborn and moving forward. So although we stay available to these families, we create a direct networking link with whatever is locally available to them when they return to their homes. So some of the services that we provide, we have a child and family life center, family center, grief assistance, interpreter services, massage classes, nutrition, palliative care, patient and family-centered care, psychologists. We offer schooling, social work, spiritual care support groups and programs, and therapaws. So the therapause is kind of cute. We bring dogs in. I know that's kind of becoming an up and coming thing in healthcare, but it's still pretty cool when you see it. So when we look at the follow-up for gastroschisis, it's really incredible that we have a survival rate, like I said, in the developed countries of 90 to 95%, and that's amazing. So prematurity and degree of peel formation and atresia account for most of the morbidity that is reported. There is perioperative complications such as sepsis and neck, abdominal visceral ischemia, and hepatic failure, and that's usually related to parental nutrition-related cholestatic disease. So in the long term, some of the things we need to be concerned about is the tolerance of the enteral feedings, because even after repair, the child can have problems with nursing, eating, digestion, and absorption of nutrients. So we need to constantly be making sure that they're growing on the growth charts and not falling below their percentiles. We need to monitor their physical growth and development, and usually they stabilize around 2 years old. And obviously, another concern can be abdominal pain and adhesive bowel obstruction and that scarring. So they can have some issues with body as they move into their teen years. So, what are the implications for our personal practice? Well, with the increase in prevalence of gastroschisis that is not explained by demographic changes, they're only establishing a maternal age link, and they do see it more prevalent in Blacks than in other um, ethnicities. We need more public health research, and it is actually urgently needed to identify the causes and contributing factors to this increase. We really need to study and figure out why this is happening, why these increases have occurred over the last 25 years, and how to get that prevalence down. So here's a little bonus content for you girls. Please don't feel like you have to watch these two videos. They are short, but they go over the allotted 20-minute time frame. So I don't want you to feel obligated. But if you are interested in further hearing a comprehensive overview with a visual explanation, I highly recommend the first video. It's just 3 minutes long. Really awesome video. It's simple, puts it in layman's terms to the point, and if you're like me, very visual, it really helps hit those points at home, what gastroschisis is and what it looks like. If you want a tearjerker that really will touch your heart and pull at your heartstrings, the second video, again, is only about 3 minutes long. Just 4 little short tales of 4 babies that have gastroschisis and their outcomes. So hope you enjoy. Please don't feel obligated. Thank you so much for your time. I appreciate you listening to my presentation. Here are my references if you'd like to go back and look at any of the articles yourself. Thank you.